Leaking during workouts, it might not just be a weak pelvic floor. New research is uncovering a powerful link between underfueling and urinary incontinence, especially in active women. When your body isn't getting enough energy, aka food, to meet your output, every system takes a hit, including your pelvic floor. In this episode of Holistically Well, I'm breaking down the connection between low energy availability, relative energy deficiency in sport, aka REDS syndrome, and why underfueled pelvic floor muscles are more prone to leakage. As a holistic doctor of physical therapy specialized in both orthopedics and pelvic floor health, along with years upon years of experience in sports medicine physical therapy at a Division I institution for athletics, I have seen how this changes in athletic women, and I've experienced this personally myself. So this information truly changes how we support athletic women, postpartum mothers, and anyone training hard while unknowingly underfueling. So let's dive in. When I was in high school, I ran cross country and track, and particularly in cross country where you run a 5K and you have that endurance-based sport where you're pounding and pounding, and you leave it all out on the course. It was so common to pee our pants as female athletes while running, and I know that feels crazy to say out loud, but I know I'm not alone. We would finish the race, and if you did not pee your pants, it was sometimes like, oh, did you run hard enough? I remember when I was a freshman, the lead senior on the team, who was the lead runner, told me, like, it's okay if you pee your pants. That just means that you ran hard. And so I began as a freshman thinking it was totally normal to pee my pants every single race. I had an extra pair of shorts to change into after the race. And that was so common amongst female athletes in our cross country area. And this topic I have not really seen discussed much until recently when some new research is coming out and showing that underfueling the body can actually impact urinary incontinence. And so when I dive back into my own personal history as a high school athlete, I definitely had relative energy deficiency in sport, which is REDS syndrome, aka low energy availability, and some other side effects of REDS does include shin splints or just stress fractures in general because the body is not getting enough fuel to support the amount of impact it is undergoing. And so it's really interesting. Today, we're going to dive into the research that is coming out surrounding REDS and its linkage to pelvic floor urinary incontinence or urinary leakage. And so this topic is really for all women. If you find yourself leaking during impact, particularly during running, and really males too, because we all have a pelvic floor. It just looks a little bit different in males versus females. So if you have a son or you know somebody who does struggle with leakage, even if they are not female, this is also relative to them. It is just definitely more common in female athletes that we see this relative energy deficiency in sport. And I mentioned with REDS that we can see stress fractures in our bone and low bone health, as well as urinary leakage. This is a new one that's coming up, is this pelvic floor leakage. But we also see missed cycles. And I've opened up before that I would get one cycle a year between the completion of track season and the start of summer cross country season. And so that is a huge marker too, that the body is not getting enough to optimally support the hormones. And then this has a trickle down effect across the board. All right. So what exactly is REDS, which will refer to relative energy deficiency syndrome, or relative energy deficiency in sport, can be referred to as REDS, and low energy availability. So REDS really is a mismatch between energy intake, aka our food or fuel, and energy expenditure, aka training and life stress. So if we're thinking of high school athletes, they have a high training volume, right? They are practicing for usually 90 minutes, 6 days a week. Usually practice is 5 days a week, and then we have a day of competition, and then we have a day of rest, and then it starts all over again. And that is a lot of training on a developing body. And then as we go through life, we also throw in life stressors. So, if you continue being an extremely active female, beyond those high school sport years or collegiate sport years and you're training for a half marathon or marathon or you're just running for fun, now we have the life stressors of work or children or, managing finances. You have a lot more thrown at you versus oftentimes when you're in high school and you don't have to worry about those extra things. So sometimes we see it early in life, really in those developing years, but sometimes it can come on later as well. So in Rett syndrome and this low energy availability, it's a time when there's not enough fuel to support all of the body systems. Our energy gets rerouted to keep you surviving and not thriving. And this is why we see that menstrual cycle fall off, because it's not a time to reproduce if your body is simply trying to survive. This affects bone health, as I mentioned earlier, and also our hormones, fertility, aka that elimination of your cycle or the elimination of ovulation. It also affects mood, digestion, and now we are finding pelvic floor function, which for me is just sending so many light bulbs going off into what I have personally experienced and seen in other female athletes. Now, this matters because it can affect athletes of all ages, not just elite professionals, but also teenage athletes. And that was me. I experienced this as a teenage athlete, and also postpartum mothers returning to sport or returning to an active lifestyle, and then anyone in a low fuel, high exertion season of life. A new 2023 consensus found that pelvic floor health is impacted too by this REDS. So in 2023, the International Olympic Committee updated its REDS health model to include urinary incontinence as a system affected by low energy availability. Studies found that women with low energy availability were 21 to 4 times more likely to experience stress urinary incontinence and 2.5 times more likely to experience urge urinary incontinence. And the difference between these two is that stress urinary incontinence is from impact. And so that is like that repetitive running in cross country, right? That would be more that stress urinary incontinence versus your urge urinary incontinence is when you all of a sudden get this strong urge that you need to use the restroom and you don't know if you can make it there in time. And sometimes that can happen as soon as you pull into your driveway at home. You all of a sudden feel this huge urge to use the restroom and you're like, I literally had no urge to go to the bathroom until I pulled into my driveway. And it's because your brain to nerve connection is signaling to your bladder, it's time to go because I'm home, I'm at this place where I have a restroom available versus the 2-hour drive you maybe just did before that. Your brain wasn't really thinking about it because the option to go wasn't there. And so we need to break that nerve connection, that brain to nerve connection that's telling you that you have to go when maybe you actually don't have to go. So we'll break this all down. This is huge because urinary incontinence has been under discussed in athletes for years. And now we have a clear physiological link that expands the conversation beyond just pelvic floor weakness. So far as a pelvic floor physical therapist, we look at urinary incontinence, whether it's stress or urge leakage, as a muscle issue, right? Or a nerve issue. But we didn't look at it as an underfueling issue. And this is huge when you think about taking a holistic approach to pelvic floor health. It makes a lot of sense. So this missing link here, how underfueling affects the pelvic floor. Let's break it down. Number 1, underfueled muscles fatigue faster. The pelvic floor is muscle tissue. If it's not getting the glycogen, strength adaptations, or repair it needs, it's going to underperform. When it underperforms, we can see urinary leakage. Number 2 would be that decreased estrogen equals decreased passive support. Now, low energy availability disrupts hormone production. This comes back to the loss of a menstrual cycle in active females, right? Estrogen, one of those reproductive hormones, is absolutely essential for ligament and fascial integrity in the pelvic region. So ligaments are what connect bone to bone. So in our pelvis, we have a lot of ligaments that are helping create extra support and stability. When we don't have estrogen, we're not getting that optimal integrity to the pelvic region. So this is both for the ligaments and then the fascia. The fascia is like this spider web structure that is beneath our skin and between our muscles. It literally when you do anatomy in collegiate education and in my doctoral program, we had to do a human cadaver lab, like you see this spider web-like structure beneath the surface, and it's just woven between everything. That is your fascia. And so we need estrogen to optimally support both the ligaments that help give bone-to-bone integrity and the fascia, which is interwoven amongst our muscles in the pelvic region. When we have less estrogen, we have more laxity and we see less support. Okay, so this is starting to connect the dots, and I don't want to get too scientific on you. I really want to make this digestible, but decreased estrogen comes from our lack of having a proper menstrual cycle, which comes from a lack of energy availability, aka not enough nourishment for the body. This then leads to decreased passive support. So when we talk about ligaments and fascia, they're non-contractile structures. They're not muscles that contract and relax to support us, right? So it's called passive support, where it's there, it's an inert structure. It's kind of like the framework of our body. It's similar to our skeleton, where it's not contracting and relaxing like our muscles, but it is passively supporting our body. And it's really what structurally helps hold things together outside of just our muscles. Number 3 here is that constipation is common with low energy availability. So constipation would be not having a bowel movement at least once a day. Now, there's a range of normal here. Some will say that going 3 days without a bowel movement can be normal for some people. I would argue we really should be having 1 to 2 bowel movements a day. Now, chronic constipation leads to a chronic strain and increased intra-abdominal pressure. So if we think of our colon is where our bowel movement sits prior to being expelled from our body. It runs along the left side of our abdomen. And so if we have stool sitting in there and it's not getting eliminated consistently every day, it's going to increase pressure in our belly and adds chronic strain downward as well into that pelvic floor. And these are 2 known contributors to urinary incontinence. And so it's really interesting to think like, oh, that makes a lot of sense. If you're not having proper bowel movements, that's going to lead to increased strain through the abdominal wall, and that affects then the pelvic floor as well. Another thing I'll note with constipation is that when individuals are constipated, oftentimes they have to strain to have a bowel movement. When you really have to strain or bear down to have a bowel movement, that also impacts the pelvic floor muscles. It's causing extra stress through those muscles versus when you have a very smooth bowel movement that is not hard to push out. Okay, so constipation is also an important link here in terms of how underfueling affects our pelvic floor. And then the 4th and final point here is that delayed or blunted training response. Okay, so even with the right exercises, underfueled bodies don't adapt as well. Rehabilitation becomes harder when our nutrition is lacking. And this is something that I have preached from the very beginning of starting my Holistically Well physical therapy private practice, is because if we don't look at nutrition as physical therapists, we are only going to get our patients X amount better. Like, we are not going to get them all the way better because our muscles need fuel to rehabilitate, to adapt, to restore. And so we need to fuel the bodies appropriately. And that's what we mean by a delayed or blunted training response, is that you could have the perfect half marathon training program or the perfect high school cross country training program from your coach. So you're getting the right exercises. But if your body isn't getting the fuel that it needs, it's not going to adapt optimally or respond optimally to that training program, okay? And that makes rehabilitation much, much harder if we have an injury as well. And so we see how these 4 points all are affected from underfueling the pelvic floor. Now, if someone is leaking with exertion, despite doing, quote, all the right things, we may need to look at the bigger picture. How is her fuel? How is her recovery? What are her hormones doing? And this is something that we look at with every single individual who comes in our one-on-one physical therapy appointments, because it is so important. Now, what does this mean for active women who is most at risk, right? And we're looking at 15 to 45 plus year olds because around age 50 is when we see the menstrual cycle typically cease. And so we're looking at things differently. We're not looking at this relative energy deficiency in sport anymore. We're shifting to perimenopause, postmenopause. So looking at women who are 15 to 45 years old, those at highest risk are athletes, dancers, and gymnasts. And they're most at risk for this REDS or reduced energy deficiency in sport. So athletes, dancers, and gymnasts, recreational runners, and CrossFitters, new moms returning to sport without enough food intake, and then women in midlife trying to lose weight while also lifting heavy or training intensely. And this area of women in their midlife who are trying to lose weight and also train heavy are challenging because their cycle can also be thrown off simply from entering perimenopause. And so we need to break it down and look at, okay, is this because of REDS that we're seeing cycle changes and some pelvic floor changes, or is it because of perimenopause? And that's where my clinical hat comes into play to help you decipher that. So some red flags to watch out for would be these irregular or missing periods, fatigue, poor recovery, or sleep issues, constant injuries or lack of training progress, and then pelvic floor symptoms, leakage, pressure, pain, or constipation. And so ding, 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 my high school athlete brain is going off. Irregular or missing periods, absolutely. Fatigue, poor recovery, or sleep issues, I wouldn't say I necessarily noticed that per se. I feel like I did pretty good in that arena. But I did struggle with stress fractures. In terms of constant injury, it was never anything super acute. It was always chronic type injuries, AKA stress fractures and shin splints were what I struggled with. And then pelvic floor symptoms, I would always leak. And then I never really had pain or constipation that I think back on, but my main symptoms was leakage. And so as you're thinking about this for yourself as a female athlete, whether you're in your high school years, collegiate, or you're into motherhood like myself, you may not be a check mark for every single one of these red flags. But if you start to notice 2 or 3 of them, then I would have a huge light bulb going off that this is likely something that is affecting you. So fueling is a foundation, not just for performance or aesthetics in terms of what we want our muscles to look like, but also for optimal pelvic floor health. So where do we go from here? As a clinician, we need to integrate fuel status and energy availability into how we care for our patients. And so that is why every single patient that I work with, there is a nourishment section. And anybody who's worked with me is like, yep, I remember that in my email. It says, nourish, and I break down some key takeaways from our discussion about their particular medical history. In my Holistically Well programs for preconception, pregnancy, and postpartum, nourishment and nutrition is absolutely something that we cover as well, because our energy intake is what is going to affect our optimal output. And then we also need to recognize as care providers that urinary incontinence is not always just due to pelvic floor dysfunction. It actually might be due to something much larger, aka a systemic energy deficit from that REDS syndrome. Now, for women who are listening, if you are leaking during workouts, please ask yourself, am I eating enough to support my output? How is my recovery? Is my period regular? And regular means typically every 28 to 35 days, and that it is pretty predictable every single month, and that you're also noticing good cervical mucus around your time of ovulation. If you're not, that means that that period is not regular. And then finally, am I dealing with chronic fatigue, constipation, poor progress in my training, or urinary issues from leakage to pelvic floor pain to pressure type symptoms in your pelvic floor? If you are yes to any of those, again, this is likely something that is affecting you and something that we definitely will want to address. So this is still a growing area of research, but it's one that we as practitioners and women can no longer ignore. So your pelvic floor is part of a whole body system. And if your body is underfed and overstressed, symptoms will speak up. And I do want to highlight here, underfed does not mean that you are trying to lose weight. So if I think back to myself as a teenage athlete, I was not trying to lose weight. I was just exercising a ton and had very low body fat to what my body and my hormones needed to optimally thrive. And so when we look at the amount of energy expenditure, particularly in these high school athletes and collegiate athletes who are training at very, very high levels, their food intake needs to be so much higher than it often is. And I ate the school lunches every day. It's not great quality, right? So we're not just talking about calories in here. We're also talking about quality. When we're saying the system is underfed, again, it is not just number of calories, but quality of the calories that are going into the system to give enough for the amount of output that is being had. And so we see that a lot in these high volume high school athletes, those who then go into half marathon, marathon type training in college, and then into motherhood postpartum because of the energy demands of breastfeeding and recovering post pregnancy. And so those are those key areas that we see. It makes a lot of sense to have this low energy availability and not necessarily from a time that you're trying to lose weight. Okay. And then stress, as I mentioned, can definitely heighten this as well. So if this sparked something in you, please leave a review. I want to hear your biggest takeaway from today's conversation. I really hope that it felt empowering to learn more about your body and also unlearn some things, right? Because again, as somebody who dealt with this back in high school, I'm like, wow, this would have been great to know back then, right? And so understanding that new research is always coming out to help us connect the missing dots, the missing links, and to better understand and treat these types of issues. So if you want holistic support for healing your body with food, movement, and nervous system health, I would love to assist you with that. So myself and my team of physical therapists do treat clients one-on-one, both virtually and in person. If you DM me consult, I will send you the link to schedule a free call to discuss how this may be the best next step for you. You can also visit the show notes. I will leave all the links there. And then, as I mentioned, we dive into this in all of my programs. So if you find yourself pre-conception, that means preparing your body before a baby, currently pregnant or postpartum, know that you will get all of the whole picture health, nourishment, movement support inside my Holistically Well programs. I'll drop the link for those below too. And as I said, leave us a review. Let me know what speaks most to you from this episode. And that truly helps guide future conversations for the Holistically Well podcast. Thank you so much for tuning in to today's episode. And I hope that you are able to go out and live holistically well. Hold on a second. Don't go just yet. I've got a special giveaway just for my Holistically Well listeners. Each month, I'll be choosing one winner to receive a free one-on-one session with me, Dr. Kayla. That's a full 60 minutes, virtually or in person, focused entirely on your individualized care with a holistic doctor of physical therapy. To enter, just hit pause, leave a 5-star rating, and share what you're loving about the show. Your feedback helps shape future episodes and helps more women find this space. I can't wait to connect with you.